Now, I wanted to move into our next panel discussion. We are in a time in the world where COVID-19 has really affected the globe, and so this discussion is going to be very, very interesting. I'm going to go ahead and let you know who our exciting panelists will be for this conversation on healthcare in the continent. So we have Sheraan Ahmad from RecoMed. It's a healthcare platform based in South Africa. We will also be speaking to Vivian Nwakah from MedSaf. I hope I got Vivian's name right there. She'll let me know if I pronounce her last name correctly. But she is running a pharmaceutical based in Nigeria. We'll also be speaking to Patrick Beattie from Redbird. That's a diagnostics and testing company based in Ghana, if I'm not mistaken. And to moderate these health experts will be Gabriella Mulligan from Disrupt Africa. So I'm very excited to hear what you have to say about innovations in healthcare on the continent. Take it away, Gabriella.
Hi, everyone. Thanks for joining us on the Healthcare Focus panel. I'm really excited to get started. So I think I'm just going to ask all the panelists to introduce themselves individually. If you can just say a couple of words about yourself and your company, and then we'll get into the conversation. Thank you. Vivian, if you'd like to start.
Vivian, I think you're on mute.
Hello. So my name is Vivian Nwakah. I started MedSaf in 2017 to disrupt the fake and substandard medication public health issue that affects all of Africa. I knew that technology could do that. And we started in 2017 kind of reducing the friction between all healthcare stakeholders. And I'm going to be honest right now, Nigeria I'm here in Lagos, and Nigeria is in a bad state, but MedSaf is on the front lines trying to make sure that our hospitals and pharmacies have access to medications for all the patients that are kind of flooding in. So here we are, we're kind of in this moment right now where you can see how using technology to kind of disrupt the old way of doing business can be beneficial for the country. So I'm going to try my hardest, but I'm here. Thank you, and thank you for having me.
Thanks, Vivian. Patrick, if you could go next.
Sure. Hi, everyone. Patrick Beattie with Redbird, calling in from Accra, Ghana, where we're headquartered. At Redbird, we deal with health monitoring and diagnosis, and we feel that, especially with the rise of chronic disease, getting access to healthcare just isn't nearly convenient enough and needs to be much more convenient if we're going to continue to be able to address the healthcare issues that arise. And so we work with community pharmacies to enable them to offer rapid diagnostic testing on site for 10 different disease areas, complete with a personal health record for the patient via several different digital technologies, so that they can start building their health record, managing their health, and without having to spend their entire day doing it. And so really excited to be on this panel, obviously thinking of everyone in Nigeria. I'm glad you're keeping safe, Vivian.
Thanks, Patrick and Sheraan.
Hi, good day, everyone. My name is Sheraan Amod. I'm the founder and CEO of RecoMed. And RecoMed is South Africa's largest healthcare booking platform and marketplace. We're really like a booking.com for clinics and doctors nationwide, pursuing a mission of increasing easy access to care for any type of consumer or patient looking to find any type of healthcare service. We also help doctors and clinics attract new patients and increase their patient volumes into their clinics. And we do this by operating websites and various other digital platforms. We power most of the platforms for the large hospital, clinic, clinic groups and medical health insurance schemes in the country as well. So that's what we do, and trying to add new platforms and products into our ecosystem at the moment. I'm based in Cape Town, South Africa.
Thank you. So as you might know, at Disrupt Africa, we do a lot of data, and we've been tracking the healthcare, the e-health systems in Africa over the past 5 years. And what we've seen is a super exciting trajectory. Over the past 3 years, we've had the number of startups operating in the e-health sphere increased by well over 50%. At the moment, we're seeing at about 180 to 200 startups operating in the health tech space in Africa, which is great news. And 2020 in particular has been a really exciting year in terms of funding. It's been a breakthrough year already. We've seen over $90 million raised by e-health startups just in the first 6 months of this year alone, which is combined more than, excuse me, more than was raised in the previous 4 years combined, which is a huge figure just for the first 6 months of the year. And obviously the elephant in the room when it comes to this is 2020 is the year of COVID. So what I'd like to ask our panelists to start with is just, if you can speak a little bit to how you've experienced the e-health sector across Africa in the years prior to 2020, and then how that compares to the activity in the space and the interest in the space this year so far. If we could start with Sheraan.
Sure. So RecoMed was founded in late 2013, and we've raised several rounds of venture capital since then. To date, the company has raised about $3 million, and we have about 1 million patient users in South Africa. Now, I mention this because if I think back to just a few years ago, perhaps to 2016, there may be 2 or 3 notable health tech startups in the country, and even in sub-Saharan Africa, there weren't that many back then. Our user base was tremendously smaller at the time, and we had very few customers compared to today. So what sort of changed? I think a few things changed. I think that firstly, the adoption of health tech changed dramatically, both from a patient and a provider perspective. From 2017, we noticed significant interest, and that's only accelerated. So I would say 2020 has been a quantum leap of a year in terms of industry adoption for reasons we can get into later, many of them obvious. But I think that growth in rapid customer adoption is what the venture capitalists and investors notice, because they're obviously chasing the customer opportunity, and that would have obviously led to a lot more investment in the space, and certainly would have led to a lot more entrepreneurs and founders in the space. I think one of the reasons health tech may have lagged as an area where startups were created is in every single country, health tech has massive complexity. The health systems are complicated. The entities that have to interplay within them, the regulatory environment, etc., is complex. So I think it just took entrepreneurs a number of years to chip away at this, and now we're going to see an accelerating volume of health tech companies emerging, and I'm very excited because if we look at the traction and the massive impact that fintech has had in the African continent, which is also a complex sector, but tend to reach a critical mass a couple of years ago, and now we're seeing a lot of exits in the space. I see health tech following a similar trajectory, so it's an exciting time for us.
And Vivian, how do you see the comparison over the past few years as compared to this year?
Yeah, no, absolutely. So when we started MedZaf, 100% of our hospitals and pharmacies at some point went to the open drug market to purchase medications. And I don't know if you're aware, there's open drug markets are these massive meeting points where pharmaceutical products are purchased, and it helps the people because they can see the products, they can check the prices, and it's all in one place. And so, but obviously you're opening up fake or substandard medications to be dispensed to patients at the end of the day. And so when we started, that was what we met on ground. And I remember having to go to hospitals and pharmacies on the outskirts of Lagos on the back of bikes, to teach people how to use Excel, how to use our platform, how to use technology as it pertains to procuring medications back then. During COVID-19 lockdown, what we saw was now this disruption of the old supply chains. Obviously, the airports are closed as well. And so now MedZaf, we've spent 3 years building, the database and the, supporting the suppliers in the market, as well as the hospitals and pharmacies. We have over 160 that we worked with throughout this COVID-19 period that are purchasing from MedZaf's platform, but we're also financing them and helping them to make the best choices around where they should be purchasing, what medications they should be purchasing. And that was definitely amplified during COVID-19 because now everyone has no choice but to get online. And so I see COVID-19 as just an amplification for all of the startups that are actually fixing fundamental issues. And, again, I'm here right now trying to get a bulletproof armored car to take medications to our hospitals and pharmacies, and the supply chains are disrupted again. So there is nothing but, a good future for tech-enabled companies, especially in healthcare, that are trying to democratize and reduce the friction between quality service. And this is the time in history right now to really change the entire continent as it pertains to healthcare. So this is the moment that we've been waiting for.
Thanks, Vivian. Patrick, can we have your thoughts?
Sure. Yeah, similar view to a lot of what's been said. I've been in Ghana in the health space since 2015, though my co-founder Andrew Kwao and I only founded Redbird in 2018, so we've been going about 2 years there. But what we've seen, I think, is maybe the belief in the market has always been there on the entrepreneurial side. I don't think there's been necessarily a drastic shift in what startups are focusing on. We've always believed in tech-enabled solutions and seen that there. I think what we're seeing is more and more every year interest from the investor side, and then as well as maybe those larger institutional players who are very important to the system, as Sheraan was saying. It's a complex system, so there are some key players that need to be won over on adoption of digital to really help accelerate change. And I think that's what, especially with this year, what we've seen is a lot of change on that side. And so I do think it's going to continue. I think it also helps that people are now seeing digital health not as a solution for a low resource market, but a solution globally that's attracting a lot more attention and therefore helps with the interest in this market. So we do see it accelerating too, though maybe in slightly different areas that were holding it up before.
Thanks. So I'd love to hear actually about how you've had to modify your offerings and also how you've had to change your business models in particular in response to COVID. I'd like to go first to Patrick, because I know you've actually launched a whole COVID tracking app, if I'm not mistaken.
Yeah, absolutely. Yes, March, of course, for everyone, I think was an interesting time, right? Where you had to rethink how you do things, even some parts of your core business. And for us, that it struck us in a couple ways, a couple really healthy ways, honestly. One of the things is we were forced to rethink how we bring on new customers, especially. So when we sign with a pharmacy or a pharmacy signs with Redbird, there's setup that's involved in person. There's training, a full day training that every pharmacy, 4 staff from every pharmacy goes through in our office. That was an all-day training. And suddenly when we went remote, a lot of these things didn't fit. And what we found, which was a great lesson for us, is we could have been doing a lot more of that digitally enabled than we were. And we were maybe holding it back rather than the customers, because what we did is we switched to online. Half the training is now online through videos and assessments that that the pharmacy staff do before they even come in, so that we could shorten our training and the necessary in-person time, along with other safety measures. And that's been really successful. And I think it struck us that, okay, wait, we need to maybe reconsider what our customers are capable of, because it turns out that we weren't addressing, or we weren't leveraging all the tools that we can. And so a lot of our core operations, we rethought in terms of how much could we bring this virtual. In addition to that, we looked at what we had built. And at Redbird, we've always adhered to a hybrid solution. We are not a pure digital tech solution. And we think that's very important, because we don't see customer preference right now for a pure, especially on the patient side, a pure digital solution where we're at. And so we've always been quite serious about that. However, the digital platform that we had, we realized could be leveraged for new areas relatively quickly. We had a base we could build off of. And so with a team of honestly volunteer and part-time developers, we were able to launch first a symptom tracking app that built off of our platform within about a week and a half. This was back in March, and launched that, which has now morphed into a product we call RedSafe, which is a daily check-in app for a health facility, or we use it ourselves as a company, where every employee can check in daily and just report any symptoms, report activities, and it gives the administration at the facility or the company the chance to look at their workforce as a whole and start gauging risk, and maybe identify early anyone who should be isolated, or just out of caution should maybe isolate, stay home, work from home for a bit until they can either be tested or symptoms clear up. And so that was an exciting change that we didn't anticipate, but I think having a solid digital platform already enabled us to quickly move into this area. And now we see the potential for this well beyond COVID-19, and as far as hospitals who are interested, or health facilities interested in interacting with patients in between visits, especially, for instance, one of the facilities is a cancer center where side effects can be quite common. And so it's been a lot of change on our side because of this, but I think some of it really good in opening up new areas for it, and some of it really good in challenging us to rethink assumptions that we had about our customers.
Thanks, Patrick. Vivian, I've seen you nodding to much of that. Can you give us your thoughts on how your business and business model has been impacted this year?
Well, I'm going to be honest with you. Our business did not change at all, right? We set out in 2017 to bring the dark into light. And that meant, bring this kind of gray market of pharmaceutical products, not just the Pfizers, the Mercks, the Sanofis, but also vetting through the low manufacturer products, as well as the tier 3 products, which might be unbranded medications coming from India and China. And we worked really hard from the very, very beginning of what medications do we suggest, what do we think should be, pushed through this market, and created the framework, the foundations, the processes, the technology that then needs to be adapted around how to deal with this kind of chaotic procurement pharmaceutical situation that we found on ground. And that's what we started working on back then. So basically, throughout COVID-19, what we saw was, again, an amplification of the things that we put in practice years ago. And so what that means is that when hospitals started to call us from, outside of Lagos, far outside of Lagos, we didn't have to blink twice about how we were going to serve them, because we had worked on vetting and making sure that we had logistics partners who can ship cross country from the very beginning. We've been financing hospitals and pharmacies since the very beginning. That's something that we always knew we needed to do. So all the pieces of what would make MedZaf to be able to be a global company was already in place. And so it's really, just expansion and making sure that when we started to get calls from patients themselves that needed medications, that we could deliver it directly to them. Hospitals, regardless of where they are at. And so, what I would say as it pertains to COVID-19 and the investor community is to really just be looking at, well, who's trying to solve real problems, real problems that people will pay for. You know, the medical tourism industry in Nigeria specifically is $1 billion a year industry. And guess what? They closed all the airports for months. What does that mean? That means that you need to now have, you know, good quality healthcare options within these countries. And that's where the investment should go, and that people will pay for it. So there's a massive opportunity here. And so for some of us, we had to adapt. Some of us were already online. It doesn't matter. You know, are we serving a need? And that is what we've always focused on.
And Sheraan, what's been happening at RecoMed?
Well, our core platform evolved as an online booking platform. So we were trying to say, avoid people needing to spend a lot of time on the phone or scratch their way through directories looking for a doctor. 70% of our bookings happened after hours, and we do anything around 50,000 bookings a month. Now, when lockdowns occurred in March as well for South Africa, we found our bookings almost instantly started to go up before that, as people were trying to access care before the lockdown. And thereafter, if you're a healthcare practitioner, having people book online reduces the queues in the waiting rooms where cross-infection can occur. So we proved quite popular for our customers this year. Now, that said, we also did something quite unique at RecoMed, which is we had integrated our booking system with the majority of practice management systems, where the doctors would do their billing and their clinical records from. And South Africa has very, very high penetration of these types of systems. So that means that all the details that are captured by our platform can be integrated directly into these other third-party systems. So we decided in April to rapidly build, over the course of a lot of energy, a telehealth system, which we built on top of Amazon Web Services Chime technology. So we rolled our own telehealth platform for our customers, and we gave it to them for free, saying, look, we understand that a lot of patients are staying home. We noticed volumes around the country dropped by at least about 50% as people stayed home, and they're still slowly recovering back to their pre-lockdown levels. So doctors and clinics were in pain. They were seeing less patients and struggling, and people were struggling to get the care because they were dealing with fear and all of that. So the telehealth system came out where people could do a video consultation to their doctor or find a new one. And what was very interesting in South Africa specifically is that prior to March, this kind of telehealth was actually illegal. And within about a month, our regulatory body published new guidance on telehealth saying it's actually fine. So it just shows how change can be forced by societal level events. And so our telehealth legislature and ecosystems evolved by 10 years in 6 months in terms of both adoption, regulation, and technology. So now telehealth is everywhere in the country. We're one of the players, and one of our big partners, this practice management provider company, for example, on health tech, they because we were integrated with their core platform, used our platform as their national telehealth platform. They're a bit of a 10,000 practitioners in the country. So it was a very interesting time for us to respond quickly to the challenge we were seeing with our customers, and we suddenly became a telehealth company in addition to a bookings platform company or a marketplace. And we've done a few other things as well. So recently we launched a PPE and medical supply store for customers that were struggling with procurement, and we have an e-commerce platform working with a couple of partners that'll ship them whatever they need on a weekly or monthly basis. And the list will go on in terms of things. So for us, COVID was very interesting. I relate to Patrick's comments around the whole team sort of sitting down in March going, what are we going to do? And we thought about it in a customer-centric way. What are the problems that the customers were facing, both on the patient side and the doctor side? And the truth is that there's been a lot of problems. So for entrepreneurs and innovative thinkers, particularly companies like ours that were really fairly entrenched in the space, it's been a very busy year. It's been a very rewarding year to build and release this sort of innovation. But I think, really what we're trying to do is respond to the problems that we see.
I'd like to focus for a minute on business models. So one of the big challenges or stumbling blocks of e-health in Africa is how do we build profitable, sustainable businesses also serving what is often quite low-income markets with little disposable spending power. And so yeah, I'd like to ask, how do you address that? How do you build models that can successfully target and be profitable when addressing consumers that are often on below $1 a day? And similarly, kind of related to that, a part two coming through on the public questions is if you could touch upon how you serve communities that are often not very well connected, not very tech forward. So if you can just address those 2 points, please. Let's start with Vivian.
Yes, no, absolutely. This is a great question, right? So for MedZaf, what we set out to do from the very beginning is we knew that the medications that we're selling are going to be quite low margin, and the benefit that we're going to give to patients is going to, or to hospitals and pharmacies, is going to be this access to affordable medications. And so we looked at, okay, well, what is valuable that every single stakeholder in the supply chain has? What is the value of them, right? What is it? And for us, it was identifying, okay, well, what do the pharma companies need that they don't have? What do the manufacturers need that they don't have? What do the hospitals need that they don't have? And let's create, a technology, but more important, technology, to be honest, was the last thing that we had to focus on. It's the processes, it's a database, it is a system. How would you build a system to make sure that what's valuable for each stakeholder can be cycled through easily? And then you build technology around that. So for us, we have figured and cracked the puzzle of how to continue to give hospitals and pharmacies low-cost medication that can beat the open drug market prices, but still be able to get enough value from them as consumers to help our other stakeholders what their initiatives are and receive money from everybody. So that is what I think, that is the kind of mindset that you need to have in Africa. And when you're really kind of creating, products that, you want to scale, because the reality is that you can't pull from the US and say, let me solve this one tiny issue. You're really building like an ecosystem. We had to do financing, we had to do logistics, we had to do, everything to kind of build up this industry on my head. Like that's how you do it here. So how do you gain value from everybody? And so that's how you can make someone who's still, where the profit margin that's quite tiny, still be able to create something that's massive that can actually change the entire face of the pharmaceutical industry to date. And I'm 100% sure that's what MedZaf has cracked today. So it's about, again, focusing on what are the needs of the people.
And Patrick, if I can go to you.
Absolutely, because I 100% agree with what Vivian just ended with there. It's all about understanding your patient, your customer, if that's what it is, what actually brings them value, and being willing to admit what doesn't, because often what might make you most excited, especially from a technology standpoint, might not be bringing that much value to one of your customers. And we feel super strong about that at Redbird too. It was great. It was a lot of the same language we use, Vivian. We view ourselves as we leverage technology to solve a problem. We're not technology first. We were problem first. And then we'll develop technology, and it's very important to us that we can develop tech that helps solve this problem. But we can't go at it with, we've got this tech that can solve all problems, and then try to sell that. And that's what we found is really key. And we've, throughout our whole lifespan as a company, we've taken periods where we've had to look at what we were about to launch and then say, you know what, actually, where's the value in this? And we've cut out huge parts of our service offering because we realized it gave us a lot of value personally, but not necessarily to our customer, and we felt that would fail. The other thing we look at is healthcare is an investment in your future, most of the time. And even worse than that, it's oftentimes an investment you make now to avoid something happening in the future. So you don't even get that payback in the future of something happening. It's just something bad doesn't happen. And that's, as a human, that's like one of the most difficult behaviors to expect of someone. Do without something now, pay something now, and then in the future, you won't have something happen. And so even though that investment, if you look at the economics over your lifetime, it makes sense. If you don't monitor your diabetes in the near term, you will have some really bad side effects in the future that will cost you a lot more in the end. It's a difficult thing for a human brain to really process all the time. So it's really important to consider not just investment and payback in the long term, but cash flows. And I think that's what we've seen in other industries, and something we've taken inspiration from is you've got to match not just that this has value, but that this matches your customers' cash flow on patients. And that's why we focus on the low-cost diagnostics we do, because it matches the cash flow better of an individual patient. Some of our busiest pharmacies are in some of the lowest income areas of Accra. Because this provides even more value in the fact that it matches their cash flow in a way other things don't. And so, that's really important to us. And we found that as important in getting to the customer and providing them value.
Thank you. And time's getting away with us a little bit, so I'd like to put you all on the spot. And I'd like to ask you for essentially two numbers from this year. How are your user bases going up, hopefully up, and what's happening to your revenues? In just literally, if you can give me two numbers, that would be perfect. Sheraan, to you.
Well, we found we're a cyclical business, depending on winter or summer season. We went up by 50% during the March and flu season surge. And we're growing now at around 14% to 15% month on month. That's where we're at. And I think that'll keep going up.
Wonderful. Vivian?
We are definitely, as you can see, I'm here in lockdown in Lagos. We've been battling situations with hospitals and pharmacies this year where movement is restricted. So we definitely saw a massive drop in what hospitals and pharmacies have typically purchased. But we've been able to grow 40% because of the fact that we've used technology to expand. So no, we are not seeing the numbers that we would have seen, on a normal day from an individual hospital. But because we are an option that has focused on technology since the beginning, we're seeing an expansion across the country without having to open up a new office, without having to invest in any additional infrastructure. And so that is, I think 2020 is the year of setting the framework for our new reality worldwide. And then that's what we're all doing and should be focused on, is setting up the framework for a new world order. And that's what MedZap has been doing.
And Patrick?
Sure. We ended last year at about 150 pharmacies in our network. We are already over 300 at this point. So we've seen great growth on pharmacy side. It was tough. We had a month of lockdown here. Ghana was very, very fortunate in that the lockdown period was relatively short compared to most other countries. And that definitely helped us. And we've seen that on the revenue. We had one of our worst quarters was Q2. And, since we were, just starting out, and we just hit for Q3 our best quarter ever on the revenue side. So it's been a bit of a roller coaster during the last year, but I think because the core model works especially well during this time, we've seen the continued interest from pharmacies, which has been great.
Thank you. We've just got a couple of minutes left to wrap up. So what I'd like to touch upon is that I think we've established that this has been really like a watershed year for eHealth. And so what I'm interested in is, do we think the new habits and the new consumer habits of adopting telemedicine and health tech products, are they going to endure in the long term? Or is there going to be a return to a preference for in-person care, really? So I'd like you to predict the future now for me. Just in a few sentences, can you start maybe, please, Sheraan?
I think it's definitely going to endure because of the COVID lockdown environment. If people now have sick kid children at home and they need a consultation immediately and they don't want to get over to a busy practice, and suddenly the technology exists to do a really high quality video call with their existing doctor or find a new one, get the medical advice, and then get that prescription fulfilled electronically right after that, and it works. Why would such a person not do it again? So I think that obviously at a time of maximum fear, there may be additional adoption. So, and when the world is back to normal, if we ever get there, those levels may come down somewhat. But on the other side, the referral adoption, so people who are using, for example, video and virtual consults from home, etc., they're going to tell their friends and family about it. So that curve is going to continue to grow. So I think if the services work, and they clearly do, and if people have now tried them and they've become comfortable with them, it's extremely likely that they're going to remain forever. I think those levels might come down slightly and then remain entrenched. So now if we're looking at 35% of the market using telehealth on a regular basis, perhaps that'll drop down to 20% and then start ticking up from there. But absolutely, it will remain entrenched and be the shape of things to come. I mean, ultimately, people are looking for convenience. They're looking for lower cost, and hopefully both of those things. And that's what all this innovation is allowing them to acquire. So I'm definitely a believer in these changes long term. On the other side, of course, the bedside manner and getting the in-person consultation is fundamental to the healthcare journey, and that's not going anywhere for a long time. But I think that the proportions are just changing.
Thanks. And Patrick, what's your take?
Yeah, it's boring to always agree, but I am going to agree. I mean, I think it's yes. The digital shift is here to stay and will increase and accelerate. I strongly feel digitally enabled decentralized healthcare is the next leapfrog opportunity on the continent. This is going to be the thing that happens, that people are going to talk about once it does for years and years. I don't think that means that you cut out in-person visits, but as Sheraan said, it's about maximizing convenience, maximizing value to the patient, and these digital technologies for certain use cases can do a lot of that. And as I think you'll see the in-person visits maybe shift more into primary care or more convenient venues like pharmacies where people are already going, but those better connected into other parts of the healthcare system. So you're getting better care, you're getting high quality care without having to physically always go into a tertiary facility. You can go into these more primary or community-based places, but the data starts flowing. And when you do visit a tertiary facility or you do a virtual consult via new technologies, that information is now being leveraged by the health professional on the other side of that call. So I see it as continuing, but in a hybrid model, of course. I think people will always prefer some sort of personal interaction with their health, and there's no reason that will completely go away, even with a highly digitally enabled system.
Thanks, Patrick. Unfortunately, we've run out of time for this session, but we will be seeing more of Vivian later. Anyway, as she's one of the 5 startups pitching live today, so we'll be chatting to Vivian again later. I'd like to say thanks to all of our panelists for joining us. It's been a really great discussion, and I'm sure everybody can continue the conversations further in the networking tools. Please do go on and chat further. We're going to move now to the next keynote session, which is on decentralizing trust to save the internet. So we'll leave you to get on with the next session. Thanks, everybody. Bye.
Thanks.